Today, we're taking an in-depth look at one of the most well-known medications used for seizures and nerve pain, Tegretol, also known by its generic name, carbamazepine. And just to clear things up right away, despite the name, Tegretol is definitely not a new kind of breakfast cereal. Whether you've just been prescribed it or you're curious about how it works, this video will walk you through everything you need to know, from how it helps to possible side effects and important safety tips. Let's dive in. Tegretol, also known as carbamazepine, not to be confused with a new brand of petrol, though it certainly keeps things running smoothly, just in your brain, not your car. It's a prescription medication that belongs to a class of drugs called anticonvulsants or anti-epileptics. It was first approved in the 1960s and remains a cornerstone in the treatment of several conditions, including epilepsy, to help prevent certain types of seizures, trigeminal neuralgia, a chronic pain condition affecting the face, and bipolar disorder, particularly for stabilizing mood in patients with manic episodes. It works by reducing abnormal electrical activity in the brain and calming overactive nerve signals. At a molecular level, carbamazepine primarily acts on voltage-gated sodium channels in neurons. By blocking these channels, it prevents the repetitive firing of neurons, a process that can lead to seizures or severe nerve pain. This mechanism also plays a role in stabilizing mood and controlling the hyperactivity that contributes to manic episodes in bipolar disorder. Let's talk about how to start Tegretol safely. Most patients begin with the lowest effective dose, typically 100 to 200 milligrams taken once or twice daily, as directed by your doctor. Your dose may be gradually increased based on your response and tolerance. Now, Tegretol can interact seriously with other medications. Some of the most important include certain antidepressants, blood thinners like warfarin, other seizure medications, and some antibiotics. Always tell your healthcare provider about every medication and supplement you take. Tegretol also carries a black box warning for serious, potentially life-threatening skin reactions, especially in people of Asian descent with a specific genetic marker. There's also a black box warning for blood disorders, like aplastic anemia and agranulocytosis. Regular blood tests are essential while taking this medication. Never adjust your dose or stop taking Tegretol without consulting your doctor. So, Tegretol comes in a few different forms: immediate release tablets extended, release tablets chewable tablets, and even a liquid suspension. Usually, it's taken anywhere from 1 to 4 times a day, depending on your specific condition and, of course, your doctor's instructions. It's really important to take Tegretol with food, since that can help reduce any stomach upset. Typically, your doctor will start you on a low dose and then gradually increase it, just to minimize side effects and give your body some time to adjust. I don't think people understand just how important it is to keep an eye on side effects with medications like Tegretol. The most common ones are things like drowsiness, dizziness, nausea or vomiting, blurred vision, and dry mouth. Now, there are also some more serious but rare side effects to watch out for. These can include serious skin reactions like Stevens-Johnson syndrome, low blood cell counts such as aplastic anemia or agranulocytosis, liver problems, and something called hyponatremia, which is low sodium levels in the blood. Always let your healthcare provider know right away if you notice any new or worsening symptoms. And remember, if your pill looks suspiciously like a breakfast cereal, double-check the label, unless you want a very interesting morning. Stay safe and may your neurons behave themselves.